Hi sir, good evening. My name is Gabriel Takagas and I am your student nurse for tonight. May I know your name and date of birth?
I am Milner Cagas. My birth is May 12, 1966.
Okay, so what I'll be doing to you is that I'll be assessing your heart and neck vessels. Would that be okay for you? Okay, so part of the assessment is that I'll be interviewing you. You can answer this with a yes or no, and also you can have some reasons with it. And don't worry, your answers will be kept private. So, would that be okay for you, sir?
Okay.
Okay, so now we will now begin in your interview. So first is about your history of present health concern. This is for the chest pain. Do you experience chest pain? Does your heart ever beat faster?
None.
Do you tire easily? And how about do you experience fatigue?
Fatigue. O kana gyud kayo. Exhausted na gyud. Pero di lang man.
Do you have difficulty breathing or shortness of breath? Do you cough up mucus?
None.
Do you experience dizziness? Do you wake up at night with an urgent need to urinate? Yes. And if so, how many times each night?
3.
Do you experience swelling in your ankle, feet, or legs?
Swelling.
For your personal health history, have you been diagnosed with a heart defect?
None.
Have you ever had rheumatic fever?
None.
Have you ever had surgery or cardiac balloon interventions? None.
None.
Have you ever had an electrocardiogram,
EED.
ECG?
ECG. Saman sa una karon
Pwede po sa una.
before
Before?
long time ago.
Long time ago. So, ato nga long time ago.
ECG 2017, 15 siguro, 2013 siguro.
2013. Have you ever had a blood test called a lipid profile?
Blood test.
Do you know what your cholesterol levels were?
I forgot the number, but I know.
Do you take medications or other treatments for heart disease? Do you monitor your own heart rate or blood pressure? For your family history, is there a history of HTN, MI, CHD, elevated cholesterol levels, or DM in your family?
Sana dim? None siguro.
Elevated cholesterol levels.
Elevated cholesterol. History man, wala.
Wala. For your lifestyle and health practices, do you smoke?
None.
What stress do you have in your life?
Stress? If too much work,
And how do you cope with it?
just sleep and relax.
Describe what you really eat in a 24-hour period.
Eat?
In a 24-hour period.
Simple. Rice. My fish.
How much alcohol do you consume each day?
1 million barrel.
Do you exercise?
Yes.
And what type of exercise?
Walking.
Walking. And how often?
4 to 5 times a week.
4 to 5. Describe your daily activities.
Exercise, like cooking, then going to the office work.
Does fatigue, chest pain, or shortness of breath limit your activity to perform daily activities?
Shortness of breath. Wala man ko ana.
Wala man. So, wala sa. How many pillows do you use to sleep at night?
1.
Do you get up to urinate at night?
Yes.
Do you feel rested in the morning? How important is having a healthy heart to your ability to feel good about yourself and your appearance?
For good performance in duties.
Okay. So now we're done in your interview. We will now proceed immediately in your physical examination. But before that, I need to provide your privacy since you will be taking off your shirt because I will be inspecting your chest, and also I will perform hand hygiene and get my things so that we can get started. So now at this moment, I will now perform the physical examination of the heart and neck vessels to my client. So first, I'll be inspecting the neck vessels. I'll be observing the jugular venous pulse. Ito ba ito? Yes. Okay. Next to inspect again is the jugular venous pressure. I'll be evaluating the jugular venous pressure. To evaluate for jugular vein distension, position the client in a supine position with the head of bed elevated at 30, 45, 60, and 90 degrees angle. At each increased evaluation, have the client's head turned slightly away from the side being evaluated. Next thing to do for the physical examination is that I'll be auscultating the carotid arteries. I'll be auscultating using the bell of the stethoscope. Always auscultate the carotid arteries before palpating because palpation may increase or slow the heart rate. Okay. Next thing to do is I'll be palpating the carotid arteries. I'll be noting for the rate, rhythm, and symmetry, amplitude, and contour of the pulse, elasticity of the vessels. And now I'll be moving on to the anterior chest. And again, I'll be inspecting the anterior chest. I'll be inspecting for any pulsation. So as I can see the apical pulse, which is normal, and I don't see any other impulses that that are abnormal. And now I'll be palpating the anterior chest. I'll be starting at the apical pulse. Identify and palpate each cardiac site using one or two finger pads for pulsations, thrust, heaves, and thrills. And again, I'll be auscultating the apical pulse, and I'll be palpating the radial pulse. Okay. And lastly, for the last part of the physical examination, I'll be auscultating for extra heart sounds. Auscultate for extra heart sounds, click rubs and murmurs, systolic or diastolic, intensity grade, pitch, quality, shape or patterns, location, transmission, effect of ventilation, and position. Okay, so that's all for the physical examination. So far as what I have observed, as what I have auscultated, palpated, there's no any abnormalities. There's no unnecessary pulsation. Um, the pulsations is good. The rhythm is normal, and everything is normal. So, sir, thank you so much for your time and cooperation. Is there anything that you need before I leave?
Okay.
Okay, thank you.